Hi, I'm Robbin Miller, host of Miller Chat. My guest today is Zayda Vallejo. She's the executive director, certified MBSR instructor, mindfulness trainer, and consultant. Did I get that right? And Sandy Lashin-Curewitz.
Yes.
She is the role of marketing and administration. Thank you for coming on.
Thank you so much, Robin, for
We're
having
here to
us
talk about the HeartWell Institute. And so why don't we just begin, because I know you have a lot to say. So tell us, what is the HeartWell Center?
So the HeartWell Center, the HeartWell Institute, is a nonprofit organization that started 10 years ago. We are in June 10th would be, this would be our 10th year. And the reason why my husband, Robert Lenhart, and I started this institution was to see if we could support our community in resources that were not rarely available, especially for people of color. There is a great center here in Shrewsbury, the Center for Mindfulness, part of UMass Medical School, UMass Memorial. I worked at the center for 16 years, and here in Shrewsbury, there's that great resource exists. In Worcester, it's a little less, and so we wanted to work with other nonprofits, with BIPOC populations, BIPOC, Black, Indigenous people of color, to have programs in Spanish and English, programs that were culturally, age, and language appropriate. And so we've been doing, this has been a work of love for the first 8.5 years, Robin. We had no funding whatsoever. We created an Airbnb. In the Airbnb supported the work of the programs, and only a year and a half ago, we were funded by an organization in California, an organization that supports mindfulness and social justice.
Oh, cool.
Yes.
Wow.
Yeah.
I'm glad that has been working for you. And that we finally have a place that, like you said, those different communities can access.
Exactly.
Because it was not, the Mindfulness Center in Shrewsbury wasn't, what I remember from taking classes there, it wasn't really attracting that community.
People of color.
Yes, the
exactly.
BIPOC
Exactly. And this has been the great joy for us to be able to access, to invite, to welcome populations that had no opportunity to take these classes because of the time that the classes were given, because of the language, because of the level of education. Usually mindfulness has been available for mainstream population, highly educated.
Yes, I remember.
And so our work is a little different in how it's not only self-regulation, individual, mental, and physical self-regulation, but also the collective that adds to the stress that we are experiencing. So it's like a feedback loop. The situations outside bring a lot of stress, and you know, it's a feedback loop. So,
I agree.
Yes.
I know.
Sandy.
Yes, and of course, the situation that we're in now, you know, because of the pandemic, exacerbated what was already a mental health crisis.
Yes.
And so many reasons why, you know, individuals are not pursuing the help that that they really need. There's a stigma around mental health, or people, particularly the populations that Zayda was talking about, are in survival mode. And so, self-care, stress relief stress reduction seems like a luxury. And so, as you had mentioned, Robbin, in a previous conversation, that in May, we're going to be declared in a post-pandemic, status.
Yeah.
But that doesn't mean that everything immediately goes away or magically goes away. So, we have a mental health crisis, and we still need to provide services and programs and reach out on an individual level to
Right.
talk about what's happening with you, and here's some things that you can do that are not overwhelming. You don't have to spend a lot of money. You don't have to take a big part of your day, and we can work on helping you feel better, and reducing the stress in your life and improving the communication that you have with others. And that's at the heart of HeartWell's mission, to make it accessible to BIPOC and other populations, communities that haven't enjoyed the levels of access that other populations have, and also to provide training for professionals in mental health care and education, psychologists, because HeartWell is also accredited to offer continuing education credits for those professions.
That is awesome. Well, that helps add to the revenue in your mission.
Well, yes. Our aim has been to see if we can give the classes at the lowest possible prices, and people can select, whatever they feel that they can pay. One of the things that I wanted to add, Robbin, is that even when the person opens up for support and tries to calls different institutions, it takes sometimes a year before the person can be seen, unless it's an emergency.
Yes.
Unless you go to the emergency
No.
room. But so it's not only the stigma in certain cultures, like in the Spanish culture. I'm from Colombia, and I'm not crazy. This type of attitude. Why do I need to go to a mental health provider? So, and also the burnout for the providers, the healthcare providers, has been huge with the pandemic. So this is something that we are, and we are providing resources for professionals, for educators. We give CEUs, continuing education credits, for educators, psychologists, social workers, and licensed mental health care workers. And we are pursuing for nurses. So we're trying to do everything possible to make these resources available, accessible, not only to the populations that don't have access, but also to providers, because most people, we are at the brink of burnout.
Yes.
We work so hard, and the healers don't get the support that we all need.
Well, I know during the pandemic, mental health people were still working while people were home. I mean, besides the first responders, people who needed like stores, but mental health providers like doctors, we were still working.
That's right.
We still had to work, and we didn't get any, in private practice, you don't get any reimbursement from the government for that.
That's right.
So we had to still go to work, and
Right.
service to people that we see.
That's right.
And
That's
it's
right.
been 3 years.
Yes, and there is no time to recover.
Mm-hmm.
It's just because we can all go on overdrive,
Right,
for
right.
a short while, but when it is relentless. So one thing that we're doing, and is really with great joy that we're doing this, is fusing mindfulness with equity and collective healing. So these two, with the pandemic, it was very clear. The racial and cultural literacy was lacking. And these conversations of how do I approach the issue of race, implicit bias, all of the things that we're all biased, And so how are we able to talk about these issues that are really very anxiety provoking for us? People want to open, people want to learn, but they don't want to offend, they don't want to. And so we have trainings where they're not Band-Aids, it's not like...
Right, I get it.
But so we have big training, and we have also small trainings, but small classes and small programs, but we have very 5 days, 7.5-hour trainings every Friday. We have one that is about to start now in April, where so it's all the practices of mindfulness, self-compassion, deep listening skills, weaved into with cultural and racial literacy, in an environment with a lot of kindness, patience, non-judgmental awareness, acceptance. And it is so rich. People of all races, all cultures come to these trainings. And it's, okay, I'm here. So, interesting. With that curiosity, that sense of exploration. And we are where we are, right?
It is what it is.
It is what it is. And that's mindfulness.
That's that moment.
Seeing with clarity, okay, this is where I am. And with kindness and great deal of compassion for ourselves, begin to move and become agents of change, even in a small way. I used to think that an agent of change were activists, people that were, that was the conception that I had about.
That's right.
And we can all, whatever we do, if we are a librarian, if we are whatever shoe shiner, we can all, in our little worlds, become agents of change.
On the smallest scale.
On the smallest scale.
Even if you buy a lottery ticket at the, when I go and get gas, people want to talk. One of the things we learned about the pandemic, as also with mental health, is that people wanted to be listened to. They felt isolated and lonely, and they didn't know what to do with themselves. They needed somebody to talk to.
Exactly.
Right? So when people went out of their house, they were talking to anybody who would listen to them.
Yes, isolation, loneliness is such a serious concern among the elderly. Among people with other challenges, people with certain disabilities. They're lonely and isolated, and so that's another area where we want to reach out and start the conversation about how there are skills and tools and practices available to start working toward relief.
Yep.
And how do we listen? How do we talk? Just little things with compassion, with kindness. In the classes, I always four little questions that we can ask ourselves, and it will improve our communications greatly. Is it true what I'm going to say? Is it true? Is it beneficial for this person that I'm speaking with? Or am I just talking because I'm feeling upset or whatever? Right. So is it beneficial to this person? Can I say it with kindness? And is it timely?
Good.
Is it timely? I used to, for months and months with my husband, Robbin, I would begin a topic that was important to me, but he was already leaving for work. And I would begin this very important topic. And I felt always I felt that he wasn't paying attention to me. That it took me months and months to understand that it wasn't the right time, right? He didn't have the space, the mental space to contemplate what I was saying. But so these 4 little sentences, is it true? Is it beneficial to the person? Can I say it with kindness? And is it timely? Simple, but it can take us a lifetime to learn, to practice them.
Yep.
And that's a great example, Zayda, because it's an example of how we need to have kindness and compassion for ourselves, something that we also forget very quickly. We're very, hard on ourselves. I mean, Zayda has been teaching mindfulness for more than 20 years, but it's an example that, we forget. We get into what we're doing every day and we forget. And it's okay. It's okay. And learning mindfulness and stress reduction practices is a reminder that we can stop just for less than a minute and have the space to remember and to choose how to respond.
Oh, definitely. I definitely agree.
And what Sandy said is at the center of our work, just because we react impulsively. This is what we've been doing, right? And so that moment, that pause, that moment of, it's like a stop sign, stop, stop, take a breath, open to the situation inside. What am I thinking? What am I saying to myself right now? What am I feeling right now? How is my body right now? Just a moment. It takes moments to understand I am out of center. I'm off at this moment. And in that pause, in that moment of stopping, we have, in that gap, we can choose. We can choose to respond instead of reacting. And this is a training, and whenever we react, because we're human, right? We're human, and with compassion and kindness, we begin again. Okay, all right. We can recover faster when we understand that we have reacted. When we have these tools of mindfulness, it's not that we'll be perfect, it's not that we'll be angels, it's that we will recognize, and then we can either apologize, we can, whatever needs to be done, we can choose something different.
The power to choose.
The power to choose.
Which is really powerful.
Exactly.
Well, we have about 8 minutes to go. Did you, I know you also want to talk about stress.
Yes. Wow, Robbin, that was fast.
Yes.
So yes, so there's mounting and mounting evidence that stress is a significant determinant to our health. It's we talk all the time, every day. I'm sure that there's a sentence about how stressed out I am, and we need to learn just what that stress is doing to us, how we feel it in our bodies.
Right.
And so, if we're not feeling well, there's a good chance that there's an element of stress involved. And the practices and programs that Zayda had been mentioning, It's not difficult. It doesn't need to be overwhelming. These are practices that can be fairly easily incorporated into daily life. So I would invite viewers, listeners to well, we'd love for them to visit our website, which is heartwellinstitute.org. But you know, check out what we have. We have from the one end of that 5-day training that Zayda was talking about to we have 4 free online meditations weekly in Spanish and English. We have a 1 monthly drop-in meditation for an hour at HeartWell, which is a beautiful place. I'm so fortunate to come to HeartWell Institute every day to work. It's beautiful, it's peaceful. And so we have that free meditation on the first Tuesday of the month. So there's a big range of ways to get this really nourishment that we need to help. And you know, so while medication is important and helpful, there are many studies. What did you say, like 12,000, 100,000?
So the studies, these are evidence-based programs, and every year over 1,200 studies.
Oh, wow.
And this magnificent, John Kabat-Zinn was really a master. He has this, the MBSR, and you have a place here in Shrewsbury that you can access, the Center for Mindfulness at UMass. How over 1,200 studies a year are published about the benefits. These are evidence-based studies. And it has been growing. In the beginning, in the 70s, this program started.
79.
79,
Yes.
exactly. And so the adaptations, I worked with many different centers at the Center for Mindfulness and Compassion at Harvard. I used to be part of the Lazar Institute at Harvard, where there were MRIs.
Oh, yes,
before the class, and then an MRI after 8 weeks, and then noticing, clearly the change in not only in the function, how our minds function, but the architecture of the brain changes in 8 weeks. It's just really.
I heard about that.
I wanted to mention also the work that we're doing at the HeartWell Institute with parents and adolescents.
Oh, yes.
We are in partnership with the Latino Education Institute, which is part of Worcester State University, and the Southeast Asian Coalition. We're working with girls. We have a 3-year program. This is our first year, almost finishing in May, of girls 10 to 14 years of age and their parents. This study was funded by Fred Daniels Foundation.
Oh, yes.
The Fred Daniels, and now we're about to start one funded by the Reliant Foundation with adolescents and their parents. A 5-day program during the April vacation, totally free. We provide the food due to the resources of the Reliant Foundation. The food will be provided, creative arts, mindfulness, deep listening skills. How adolescents, there is a lot of difficulty for parents to communicate with adolescents.
I know, I have one. You have one too.
So how to give the skills in this, so relationships are golden bonds throughout life, instead of, these relationships that can suffer a lot during adolescence.
Definitely. Well, the thing is, when you talk to your child, they're doing this, and you have to say, take off your phones, put that down, and then talk.
Yes.
How to talk without wearing electronic equipment.
Exactly.
People,
and how to do it mindfully.
right?
Is, because to say you don't do it it's not going to work because we are all in this milieu of technology. But how can we learn to do it mindfully? How can we take an email and instead of responding immediately, take a moment,
Oh,
come
yes.
come back to ourselves and choose to respond instead of that charge to.
Well, people have texting walls. That.
Exactly.
Gotta be careful what you put out there. So we have less than 2 minutes. Is there anything you'd like to share? Anything?
We have just 2 programs that we wanted to, actually 3, but 2 programs. We teach in Spanish and then English. And so right now, April 5th, we have a mindfulness-based stress reduction in Spanish,
Great.
which is not very easy to find. And people can select, starting April 5th, and you can select to pay $25 for the 8-week class, or $75 or $150, whatever you feel that you can pay.
Sure.
And there is another class of mindfulness and self-compassion in Spanish, and that class is $100 for the 8 weeks with trainers. The 2 people that are teaching this class, they are not only instructors,
Right.
but they train instructors with a lot of experience. So we have the 5-day mindfulness as a catalyst for equity and collective healing for professionals, this cultural and racial literacy. 5 Fridays, beginning the last Friday of April.
And
You're
that's
most welcome to come, Robbin.
and that's in person at
In
HeartWell.
person.
The other 2 programs in Spanish are online, so they're accessible from anywhere.
Yeah, so it's 8:30 to 4 o'clock for Fridays. You come, you take your shoes off, you just, this is an environment that is very nourishing, blankets and cushions. You can sit on the floor, you can sit on the chair, you can move. It's about taking care of yourself. And whenever we say 5 days, people say, 5 days? Oh, I cannot find, it's impossible. My life, and we always say, the year has 365 days, 5 out of 365. Can you give yourself 5 days out of a year? And for employers, to support their employees to prevent burnout, to decrease absenteeism, to diminish depression, to take good care of your people, to give the time so people can learn to take care of themselves, so they can in turn provide the resources to other people, whatever they need.
Yeah, and to support the diversity, equity, inclusion, and belonging culture
Yes.
in organizations.
Well, we're out of time.
Thank you so much.
Yes. So
Thank you,
You're
Robbin.
So I thank Zayda Vallejo, who is Executive Director, Certified MBSR Instructor, Mindfulness Trainer and Consultant, and Sandy Lashin-Curewitz, Marketing and Administration from the HeartWell Institute. Thank you very much for coming on.
Thank you very
Robbin.
much. Thank
Good night.
you.